founding chief medical officer of CityBlock, which is a company that works to really do longitudinal care, really do population health with people who are not necessarily, they don't necessarily have access to the health system. So I wonder, to go from something that is more comprehensive and really focused on equity, health equity, to now urgent care clinics through telehealth, that seems like a 180 to me.
So I'll zoom out. I think you're right. When I look at my career, I think I've touched on a lot of aspects of the healthcare system and been able to learn a lot from each of those interactions. But for me, I think one of the key insights I learned was that at the end of the day, most patients, I would actually say all patients, all customers, all people want to be healthy. The reason why they're not healthy is because the health system has all of these barriers. So whether that is cost, confusion, there are a lot of barriers to customers being as healthy as they want to be, some societal, some within the healthcare system. And so that's really on us to remove those barriers and think through how we do that. Now, when I zoom out and think of Amazon, Amazon is a company that really has a competency around delivering delightful experiences for customers and kind of removing those barriers. But they're also a company that has hundreds of millions of people using their products and services every day. So to me, it was really about thinking through, if we can have just a fraction of those people, if we can impact them, that's such a massive scale to be able to do good on. So it was really being able to zoom in and think through, how can we use those resources and point those toward health.
When I think about urgent care, there are already so many services, there are already so many competitors. Why do we need Amazon to bring that to us? What does Amazon Clinic offer us?
So I would think of Amazon Clinic as a marketplace. So similar to what Amazon does well on its retail site, connecting buyers and sellers to the products they need. I think we're doing the same thing with Amazon Clinic. So I would think of it more as a marketplace where you can find providers and provider groups for your issues. So right now that focuses on connecting people rapidly to common conditions. So you're right, you go on Amazon.com, it's on your mobile app already, it's on .com, it's the places where you already are, so you don't have to download anything new. You choose a condition that you have, so a need that you have. You can choose the telehealth provider, you can choose the provider group that you want, so injecting that choice into the experience for you, so you can choose on the factors that matter to you, and then you can message back and forth with the doctor to rapidly get the care that you need. So with Clinic, it's really about fitting that specific need and addressing that need for that customer.
So you've been around for 5 months now. How is business going? What are the patterns that you're seeing in terms of what are the things that people really are looking for there?
Yeah, so we've also been overwhelmed by the response from customers. Their responses actually exceeded what our initial projections were, which is really great. But the feedback we often get from customers is they want more. So they want more conditions. They want to be able to use us for more and engage in more. So we're working through that feedback now to let that guide how we're going to expand the service over time.
So if I go there, am I going to see the usual suspects, the doctor on demand, the teledoc, or am I going to see ones that maybe I haven't heard of? I think about Amazon Marketplace giving smaller entrepreneurs a place where they can reach a wider audience.
Yeah, so to us, it's less about kind of size, whether it comes small or big. I think there are big players who are delivering great care and a great experience, and there are small players who are delivering great care and a great experience. To us, we're focused on bringing on providers who are delivering that great customer experience and that great care.
Is this a way to help amplify some of those doctors who might not necessarily, you might not know that there's a doctor in your state that is an asthma specialist that you could see on a quick basis if you have a problem?
Yeah, if you think about the concept for Clinic, really it's about thinking through, there are a lot of really, really good folk delivering a lot of really good solutions, but not everyone knows about them. So it's saying, how can we use Amazon as a way to amplify a lot of the great things that are happening in localized areas. So what can we do to help amplify them and honestly extend their reach and expose them to a lot of customers who wouldn't have otherwise known about these options? So I think that's part of what we're trying to do with Clinic.
One of the things I was talking to Tyler about earlier was that these days a lot of folks are looking beyond wanting just a one-point solution. And Amazon, you've got the clinic, you've got the pharmacy, and now Amazon completed the acquisition of One Medical. I know you're responsible for the clinic, but how do you see that potentially working all together?
So, before I ran Amazon Clinic, I was part of Amazon Pharmacy. So, I think I've had a good purview around a lot of our health businesses. And for us, we think about what we're trying to do, and it is early days. We're only 3 years into this journey writ large. But when we think about what we're trying to do, it's really about making it easy, making it dramatically easier for customers to find, to choose, and to afford the products and services they need to get and stay healthy. So for us, that means, one, making it easier to access care, whether that's longitudinal primary care, something that One Medical really excels at, whether that's being able to find a clinician quickly for a common condition, which is fits more in the clinic purview, making it easy to find and access the medications customers need. So making that easy by delivering it to them for free, having very low cost insurance and cash pricing.
Although everyone else is kind of talking about doing the same thing, and they have physical locations like Walgreens, and they talked about how yesterday on their earnings call, Roz Brewer was saying how they now have seen people who go to an MD clinic when it's close to the Walgreens, they are more apt to fill their prescription there. How do you make that happen when Amazon doesn't have its own PBM, Amazon doesn't have its own health insurance company to try to help people in terms of their network to make that worthwhile for them?
So I think part of what makes it work for us is because we can focus on the customer alone. So we don't, it gives us kind of a clarity of purpose that we can focus in on just the customer, and that's who we're serving. So you'll find Amazon Pharmacy works with multiple PBMs, it works with multiple insurers. We work well with really any doctor, so therefore that makes it something that's easy and very universal.
And one of the things that I also wonder about is that, true confession, I use Amazon a lot, so they probably know a lot about me, more than I can think of. But people worry about privacy when it comes to healthcare. I purposely don't join the membership on our PBM because it connects to the app and all of the things that I do in terms of my retail. And I don't like the idea of that coming together. How do you maintain that separation and preserve people's privacy? We're all very worried about our data these days.
So privacy is paramount to us. One, we follow all the applicable laws, HIPAA and the other regulations. That's first and foremost. But beyond that, customer trust is foundational to everything that we're doing and everything that we're building. So therefore, we've had privacy and also security built in from the beginning of every single one of our healthcare businesses. It's critical for us that patient health information remains safe, secure, and separate.
So if I were on Amazon Pharmacy and I am on some diabetes medication, they're not going to say, hey, Bertha, why are you buying all that ice cream at Whole Foods?
That's right.
Which probably would be a good thing to say, maybe you want to think about buying fruit rather than ice cream, but at the same time would feel very intrusive.
And I think you bring up a great point around food and nutrition. I think that's probably the other pillar of what we want to do with healthcare services is we know that care and medication are two important pillars, but there's more. There's food, there's nutrition, there are other kind of products, whether that's DME, canes, walkers, there are other things outside of care and medication that make a difference. And we do think Amazon, we have some unique assets to bring to bear to also connect patients to those other things that they need for their care as well.
Is that something that you foresee, for example, at One Medical, the primary care doctors, being more more involved with that and recommending that? I know they kind of do already.
Yeah, I think One Medical is already, they already kind of lean forward and being able to really engage with their customers and deliver that holistic experience. So I think it's something that they already do. For us at One Medical, we have a saying at Amazon, it's always day one. But with One Medical, it really is day one. The deal is just closed. So we are very excited by what they've built. And I think there's a lot we can do together, and we'll get feedback from customers to help us understand how we continue to take the great experience they've already built and make it even better.
That's what I wonder about. I was speaking with a doctor from One Medical and I asked her, how do you feel about this acquisition? She said, kind of nervous. The one thing that made her feel optimistic was that Neil Lindsay, your boss, is a One Medical member. Because so often when we see a really big company take over a small company, the idea is that they can scale them, but those mergers don't always work out that way.
I think for us, we have so much respect for what One Medical has made and built. We want them to maintain. They have a great culture and a great experience they built for patients. If you talk to One Medical customers, the patients love their experience. In a lot of ways, that's what you want primary care to be for all Americans. But also, if you talk to the clinicians, they also love the experience there. And that's an amazing thing. That's the kind of culture that you preserve and nurture and learn from.
So how much more interaction? You said it's day one now. So if we go to day one a year from now, how much more seamless will it be when I go to Amazon?
So I think to us, it's less about it being seamless with Amazon and more about it being seamless for the customer. So I think that's who we're going to work back from, is what does a seamless experience for the customer look like throughout healthcare, throughout your healthcare experience? Because as you know, when you're going through healthcare, depending on who you are, you're interacting with a lot. You're interacting with hospitals, you're interacting with radiology. So to us, it's how do you make that journey seamless for the customer throughout their healthcare journey? Because that's what matters.
But one of the biggest interactions, that's the biggest cause of friction for a lot of us, is the paperwork, the insurance. How do you make that easier?
Yeah. We've got some thoughts on how we can make the seams better and make the experience better. But again, we're going to take that feedback and iterate and innovate on it. But we can't give away kind of the full roadmap.
And you can't give away the full roadmap, okay? It reminds me of when doctors sort of say, well, it's not known right now. If you were to pick one thing that you think it's critical for you to get right, what would it be?
The customer experience. Again, when you're focused on the customer.
You talked about how this has been a change of vocabulary for you. You're a doctor.
Yeah.
And Harvard doctors who, for those of us who grew up in Boston, we know they are like the gods, right? And you always talk about the patient, and now you're talking about the customer. Is that something that's intentional?
Yeah, it's been a shift. So I always use patient because to me, patients are the people that I care for. But at Amazon, they talk a lot about the customer. And the reason why is, the thinking is that a lot of times in healthcare can at times be a bit paternalistic. Care can be a thing that we do to patients rather than with patients or for patients. So when Amazon says customer, to them, that's the person that you're serving. That's the person who's making the decisions, and it's a different frame, right? It kind of shifts the power dynamic where the customer is the one who is deciding, what happens. They are sort of directing things, and the rest of us are there to serve the customer. And it's a frame that I like because it puts us in kind of a servant leadership mentality and mindset.